embarrassment when it does. So this morning, Dr. Roland Rayner with Health Texas Medical Group is here to answer questions about erectile dysfunction. And we do want to mention before we start this segment that this is a very sensitive topic. Might be a little bit of some graphic discussion. So if you have children in the room, you might want to take them out of the room. Don't turn us off, but please be mindful that this will be a sensitive topic for children. Dr. Rayner, thank you for being here this morning.
Thank you.
I asked you during the break, is this, first of all, let's define what erectile dysfunction is.
Erectile dysfunction is the inability to obtain an erection sufficient enough to complete intercourse.
And you are seeing quite a few patients with regards to this?
You know, it's a very common problem. It's estimated that about 40% of men, it actually approximates a decade of life, about 40% of men in their 40s have some degree of erectile dysfunction, and it follows per decade of life. So about 50 years old, 50% of men, 60% of men at age 60, 70% of men at age 70. So when you have all these guys talking about, you know, what's going on when they're 70 years old, for the most part, it's probably not true, because by the time you're 80 years old, about 80% of men will have significant difficulty achieving an erection.
And I would imagine, Dr. Rayner, you probably see a lot of men who maybe haven't discussed it in detail with their wives or girlfriends, just because it is sort of an issue that's, I guess, it is somewhat embarrassing to men. What are the causes of erectile dysfunction?
There are a number of causes. It's really part of the aging process to a certain extent, but it really has to do with the hardening of the arteries. As we get older, what happens is that blood flow goes into the penis, and that's actually what causes an erection. So anything that affects the nerves that go to that area or the blood supply actually affects or causes the ability or the inability to have an erection.
I was surprised to find that 30% of men in their 30s suffer with this.
Yes, that's right. And it's really probably a sign of our times as we're living longer, as we're having more unhealthy lifestyles, problems like diabetes and high blood pressure. Smoking is terrible for erectile dysfunction. They used to have a commercial where they had a guy who was smoking and the cigarette went down. That was a great commercial because it was true. It was true. It's really sad. So the things you do is you lose weight, you exercise. It's actually been shown that when men do this, it actually improves their sexual function.
Well, let's talk about, Dr. Rayner, some of the therapies that are available, because the good news obviously is that there is help.
Yeah, I tell you what, you know, I thought about this topic because as I was driving here the last time, they were having the 10-year anniversary for Viagra. 1998, Viagra came around. Before then, it was really considered almost a taboo for anybody to talk about sexual function. But now it's something that we talk about very freely. We have a number of medications now that work very effectively. We have the newest, the first one, which is Viagra, then Levitra, and Cialis. And Cialis is the one that lasts for 36 hours.
Yes.
And they're also doing some things now to where you can take a lower dose, for example, of Cialis every day. The usual dosage is 20 milligrams. You can take 2.5 or 5 milligrams every day, and you're capable of having an erection anytime. But these medications have been out now for 10 years. They work about 80% of the time. So this is amazing therapy, great efficacy. I can't tell you how many men are so happy now. I was thinking about coming over here with the robe and a pipe like Hugh Hefner. I mean, our lives have been changed. It's a revolution.
Yeah. Now, there are other non-oral medications available on the market?
There are other forms of medication that, generally speaking, you would want to see a urologist for. There's a little pellet that would be inserted into the penis. There can be injections that can put into the penis as well. And then there's surgery, and there's a vacuum device that can be used as well. But those are more significant, aggressive forms of therapy for erectile dysfunction.
Once you administer therapy, Dr. Rayner, how often do you suggest follow-ups in terms of patients coming back to see you to see if they are having success?
Well, you know, generally speaking, I see them back in 2 or 3 months. I may give them different samples of different things to see what they like. But this is one of the things where it's so nice to treat, and you have such an amazing response where everybody loves you. You know, the man and the woman as well.
I was going to say, I'm sure you hear a lot of success stories about the relationships getting better and improving. Well, it certainly is wonderful information for men. Yes. Absolutely. We thank you for being here,
You're very
Dr.
welcome.
Rayner. And if you have more questions for Dr. Rayner, he is with the Health Texas Medical Group of San Antonio, and they have 10 convenient locations throughout San Antonio. And for more information, there's the number on your screen, 731-4864. Dr. Rayner, you always come with great information. We appreciate you being here.
Very welcome.
Thanks so much.